This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update coming to you from the Health Broadcasting Service HBS radio channel. Hong Kong to focus COVID resources on elderly. Hong Kong announced plans to devote more medical resources to elderly people on Wednesday as COVID-19 infections swept through care homes and deaths climbed rapidly among the mainly unvaccinated seniors. The government will strengthen medical treatment and resources and set up more isolation and temporary care facilities for elderly coronavirus patients, Chief Executive Carrie Lam told a media briefing. Hong Kong is rushing to build facilities for COVID-19 patients, with Reuters drone footage showing construction work in full swing after a temporary bridge linking the southern Chinese city of Shenzhen to the Asian financial hub opened at the weekend. Next, Shanghai steps up defenses against wave of asymptomatic cases. The Chinese financial hub of Shanghai is moving quickly to halt the spread of COVID-19 amid a rising wave of local symptomless cases, testing tens of thousands of people, delaying dozens of concerts and exhibitions and shutting some public venues. Shanghai reported 62 domestically transmitted asymptomatic infections for Tuesday, the seventh consecutive day of increases in such cases, official data showed on weekend. That was the highest daily count for the city since China started in late March 2020 to classify symptomless infections separately from confirmed cases. Meanwhile, Austria puts its COVID vaccine mandate on ice. Austria is suspending its COVID-19 vaccine mandate, its ministers for health and constitutional affairs said on Wednesday, 6 days before fines for breaches were due to start being imposed. The measure, the most sweeping in the European Union as it applied to all adults with few exceptions, has been in effect since February 5, but enforcement was only due to begin on March 15. Because the Omicron variant of the coronavirus has tended to cause fewer severe cases than previous variants, the strain on intensive care units has eased. Romanian government to lift COVID restrictions. Romania will lift all COVID restrictions from Wednesday, including requiring a digital pass to access institutions and the obligation to wear protective masks both indoors and outside, Health Minister Alexandru Rafila said on Tuesday. The country remains the European Union's second least vaccinated state, with just under 42% of the population fully inoculated amid distrust in state institutions and poor vaccine education. France's new infections start creeping up again. French health authorities reported 93,050 new COVID-19 infections on Tuesday, the highest daily total since February 22, and an increase of 16.6% versus a week ago. The number of new daily infections has now shown a week-on-week rise for the fourth consecutive day, reversing a declining trend that started at the end of January. Omicron subvariant BA.2 makes up 11.6% of COVID variants in US. The BA.2 subvariant of Omicron was estimated to be 11.6% of the coronavirus variant circulating in the United States as of March 5, the U.S. Centers for Disease Control and Prevention said on Tuesday. Scientists are tracking a rise in cases caused by BA.2, the dominant variant in South Africa, which is spreading rapidly in parts of Asia and Europe. Pfizer begins COVID pill study in high-risk children aged 6 to 17. Pfizer said on Wednesday it has begun a mid to late-stage study of its antiviral COVID-19 pill for non-hospitalized children aged 6 to 17 years who are at high risk of developing severe illness. Pfizer's Paxlovid pill is authorized for emergency use in the United States for kids 12 years or older and high-risk adults. But there are no oral antiviral treatments for COVID-19 authorized in the United States for younger children. Meanwhile, in another development, COVID cases deaths falling in Americas, but too soon to lower guard, PAHO reports. The Pan American Health Organization, PAHO, on Wednesday said COVID-19 cases fell by 26% across the Americas last week while deaths from the virus dropped by nearly 19% but cautioned that some effective measures to curb infections should be maintained. The region recorded 1.1 million new infections during the period with 18,000 COVID-related deaths. We all want the pandemic to be over, but optimism alone cannot control the virus. It is too soon to lower our guard, PAHO Director Carissa Etienne said. Etienne also noted that the number of reported cases in countries may not reflect the actual figure due to a possible reduction in testing. There are still some countries and territories reporting increases associated with the latest COVID-19 surge, she said. The PAHO chief pointed out that it has been 2 years since the beginning of the pandemic, just before COVID transmission became widespread in the Americas. Since then, at least 6 million people have died around the world, with the Americas accounting for almost half of the deaths, including nearly 965,000 in the United States. With more than 2.6 million lives lost, we reported the most COVID deaths out of any other region in the world, Etienne said. In the first 2 months of 2022 alone, 63% of new global cases have been reported in the Americas. I'm afraid that there is no going back to normal at this time, that we need to continue with some of the measures that have proven to be effective, and in particular, we need to ramp up the vaccination coverage, said Etienne. In the story, A War for Life of Our Child, Health Crisis Spills Out of Ukraine Conflict, Katia was on the way to hospital for an urgent operation for her 17-year-old daughter Alinka, who has bone cancer, when Russia invaded Ukraine. Their doctor at Kiev's National Cancer Institute called them and advised them to turn around and go home for their own safety. It soon dawned on the family that the only option was to continue Alinka's treatment abroad. We decided this without hesitation, because this is not only a war with our occupiers, but also a war for the life of our child, said Katia, who did not give her surname. She and her daughter are now in Warsaw, Poland, awaiting more treatment for Alinka, whose condition is stable. They are among more than 1 million people who have fled to Poland from Ukraine to escape the escalating war. Another 700,000 have gone to neighboring countries like Romania and Moldova. 4 million people may ultimately flee, the United Nations has estimated. The World Health Organization is warning that the exodus raises the specter of a regional health catastrophe on top of the huge toll in death and destruction from the fighting in Ukraine. It's not confined to 1 or 2 countries, but really regionally and globally, World Health Organization Europe Director Hans Kluge told Reuters in an interview late last week. In wartime, healthcare crises, a lack of access to hospitals and treatment, outbreaks of disease, malnutrition, and the like, often kill far more people than bombs and bullets. In Ukraine, U.S. Secretary of State Antony Blinken said last week, there have been Russian strikes on hospitals, schools and homes. Critical drug shortages have arisen, and neonatal wards have been moved underground to shelter from bombing. Russia denies targeting civilian infrastructure. The fear now is that the refugee influx into neighboring countries will push their health systems over the edge too. The World Health Organization's Kluge said health services in Poland, Slovakia, Romania, and Moldova were coping so far. But this is as of today. We have seen in the past that health systems have a breaking point, and the situation is very unpredictable. Those bearing the brunt of refugee arrivals fear that the breaking point is close, pointing out that the numbers of beds and doctors cannot double overnight, particularly in healthcare systems already exhausted by 2 years of COVID-19. We can announce that we will treat all Ukrainian children, but I am afraid it is simply unrealistic. We will provide the best possible help, but we cannot work miracles, said Ernest Kuchar, head of pediatrics at the Medical University of Warsaw Hospital. The Polish Health Ministry said its hospitals have the capacity to treat around 7,000 patients from Ukraine. Longer-term challenge. Up to 1 million new potential patients would overwhelm any country's health system, according to Kate White, Emergency Program Manager for the aid group Medicine Sans Frontières Doctors Without Borders. For the short term, international humanitarian agencies, national governments and volunteers are scrambling to send trauma kits, emergency medications and ambulances to border crossing points with Ukraine. As yet there are no field hospitals on the Hungarian, Polish, Slovak or Moldovan borders, the United Nations Refugee Agency confirmed. The European Union, which has granted Ukrainian refugees temporary residence rights, which includes access to medical care, is also working to help member state Poland, and White said the EU standardized regulatory environment could make shipping emergency supplies to the country quicker. Some refugees are also reaching EU member states further west, for example, Germany has registered 50,000. But all partners involved in the relief effort said it was longer-term or chronic needs, often among patients arriving without documentation, medication or the ability to speak the local language, that could prove the biggest challenge. These include treating people like Alinka, as well as those with other diseases including diabetes, HIV and tuberculosis. Ukraine, a country of 44 million, has 2.3 million people with diabetes, 250,000 people living with HIV and around 160,000 cancer patients, according to the latest WHO estimates. Alongside trauma injuries, the World Health Organization has classed dealing with some of these conditions as its highest priority in its most recent report on the health impact of the Russian invasion. Diabetes, COVID-19 and other infectious diseases, and cardiovascular and respiratory conditions are all marked red, meaning that without attention there is a real risk of high levels of morbidity of mortality from the impact of the war on healthcare, the assessment reads. In Warsaw, Kuchar said, almost every refugee child arriving at his hospital has tested positive for COVID-19, probably due to the cramped conditions in which they fled Ukraine, where new coronavirus cases were averaging around 27,000 a day pre-war with only 35% of the population vaccinated. Mental health is also red on the World Health Organization's list, as refugees cope with unthinkable trauma. Katia, in Warsaw, understands that. She broke down as she explained the arduous 24-hour journey she made with her sick daughter to reach the Polish capital. Her husband and 3 other children remain in Ukraine, and she is desperately worried for them, as well as about how Alinka will recover from the trip and get the treatment she needs. Katia said that what has happened to Ukraine in recent weeks is hard enough for a healthy adult to cope with, but the pressure on a sick child is unthinkable. You have to hold on, she said. Attacks on Ukrainian hospitals, ambulances increasing rapidly, World Health Organization warns. The World Health Organization said on Tuesday that attacks on hospitals, ambulances and other health care facilities in Ukraine have increased rapidly in recent days and warned the country is running short of vital medical supplies. The United Nations agency on Monday confirmed at least 9 people had died in 16 attacks on health care facilities since the start of a Russian invasion on February 24. It did not say who was responsible. The World Health Organization's senior emergency officer for Europe, Catherine Smallwood, told a news briefing that the tally included incidents where ambulances had been commandeered for purposes other than emergency health care. We will continue to update those numbers. They have been increasing quite rapidly over the past few days, Smallwood said. The agency was working to rapidly supply medical supplies to Ukraine, where oxygen, insulin, personal protective equipment, surgical supplies, and blood products are running low, Europe Regional Director Hans Kluge said at the briefing. The supply of oxygen, children's vaccines and mental health expertise were among the World Health Organization's top priorities for the region, he said. Kluge also stressed the need to prioritize the health needs of women, including maternal health and emergency obstetric care, and to respond to sexual and gender-based violence. Past conflicts have shown us that adolescent girls, women with disabilities and elderly women are in the most vulnerable situation. They face an increased risk of suffering attacks by people outside the home and by armed groups as well as intimate partner violence and sexual abuse and exploitation, said Kluge. Please feel free to connect with us on our Facebook platform at Health Broadcast and our website at www.healthbroadcastingservice.com. Remember to press the subscribe button to stay abreast of timely, vital, and authentic health news developments from around the world, delivered to you by the Health Broadcasting Service, UK, on our YouTube channel. We will bring you updates as more news develop. Stay safe, remain healthy. And bye for now.
You've been watching the Health Broadcasting Service YouTube channel. Your channel of excellence and distinction. Pioneering specialist radio broadcasting. Giving you the best experience. Subscribe to our channel.